Hello guys, welcome back to another video. Welcome back to this channel. If you're watching this video for the first time, please consider clicking that subscription button, like my video, share and comment, and make sure you're a family by subscribing. So today I want to talk about fibroid because a lot of women are suffering from fibroid, and maybe they don't know the causes, they don't know the signs and symptoms, they don't know how it can be managed. So guys, make sure you watch this video up to the end. So guys, what is fibroid? Before I talk about the causes, the signs and symptoms, and the management, and is it treatable, and also can a woman get pregnant when she has fibroid? So fibroids are non-cancerous tumors that develop in a woman's womb or in the uterus. And these fibroids, sometimes they can make the abdomen to swell or to extend, and also they can make the woman to suffer from lower abdominal pain, and also they can cause heavy bleeding. So those are the major signs and symptoms of fibroid. And fibroid is non-cancerous, and rarely do they turn into cancerous. Sometimes they usually turn into cancerous, or they can turn into cancer, but it is rare. So sometimes fibroids can be called lymphomas, they can be called myomas, they can be called uterine myomas, or they can be called fibrofomas. Those are all names that a doctor or a nurse or any health practitioner can refer to it. So if you hear someone talking about fibromas, lymphomas, myomas, uterine myomas, those are just another name of fibroid. And also, so we have different types of fibroids, and I'm going to discuss each and every of them. So different types of fibroid develop, they are called according to where they developed. So we have intramuscular, so we have different types of fibroids, and they grow to different parts of the womb, and they are called according to where they grow. So it is not only inside the uterus where these fibroids usually grow, but they can grow even outside the uterus or in the layer of the uterus, and that is according to where they grow is how they are named. So the first one, we have intramural fibroid. It is the most common one, and it usually appear within the muscles, or it grows in the muscles of the uterus, and it can make the uterus to become large, and also it can stretch the uterus. So then the second one is subserosal fibroid. Subserosal fibroid, it's grow on the side of the uterus, which is called serosa, and they grow large to make the womb appear bigger on one side. So if you see somebody is having a uterus or abdomen is larger on the one side, this person might be having subserosal fibroid. Another thing, the next type is pediculoted fibroid. Pedinucleated fibroid. So pedinucleated fibroids is subserosal tumor that develop into a stem, and this stem, they are slender base that support the tumor. They have this, what am I saying? Subserosal tumor can develop a stem. Yes, they can develop a stem, a slender base that support what? The tumor itself, because I've said the tumor, the fibroid is the tumor. And they can also make the uterus to become large and stretch, and somebody can see it just from outside. And then we have submucosal fibroid. This type of tumor develops in the middle of the layer of the uterus, and submucosal tumor are not as common as any other type. Yes, and so those are the types of fibroids that usually develop in the uterus. So let us look at what are the causes of fibroid. So first of all, we have the hormonal cause. Hormones are the ones that are responsible for the growth of the uterus, or regeneration of the uterus, because these hormones, the progesterone and estrogen, are the hormones that help the woman to regenerate the uterus, or to help in ovulation and also in the menstrual cycle. So these hormones are the ones that also are responsible for the growth of fibroid. So, and also we have a family history. Family history can predispose one to fibroid. If your mother, your sister has ever suffered from fibroid, it means that fibroids will be running in the family. So if you're a woman, you can also suffer from fibroid. Also, we have pregnancy. When you're pregnant, progesterone and estrogen are always high because they support the pregnancy. And so it means that sometimes if you're pregnant, you can start developing fibroids if these hormones are more. So who is at risk of getting fibroids? The first person who is at risk of getting fibroids is pregnant woman, because of the elevation of estrogen and progesterone. And also if you have a family history of fibroid, and also age 30 and above, and also they're saying that American women also can suffer fibroid compared to, African American women usually suffer from fibroid compared to whites and the normal African. And also if you're obese, you can suffer from fibroids. So the next thing I'm going to talk about is what are the signs and symptoms of fibroids. How can I know that I have a fibroids, or how can someone tell that this woman is still suffering from fibroid? So the first thing is heavy bleeding between the cycle, and also with a lot of clots. That one will make you to know, or you can suspect that you have a fibroid, and you should go and see your gynae before it is too late. The next thing is the pain in the pelvic, or in the lower back, or in the lower abdomen. You can get pain at those areas. And the next thing that someone will suffer from is increased menstrual cramp. Those women usually suffer from cramps during periods, and sometimes they are normal. And if it is extreme, that even painkillers or maybe exercise, those normal things that we do when you have cramps cannot reduce this cramp, then you should go and see your gynae. Maybe you are having fibroids and you don't know. And also the next thing is pain during intercourse. If you are suffering from fibroid, or if you have fibroid, you might suffer from pain during intercourse. So you should go and check. You might be suffering from pain. You might be having fibroid and you don't know. The next thing is pressure or fullness in your lower abdomen. Yes, pressure or fullness in your lower abdomen is also a sign of fibroid. Swelling or enlargement of the abdomen is also another sign of what? Of fibroid. So how can this fibroid be diagnosed? A woman will be sent for an ultrasound, and also you can be sent for MRI, and also X-ray can also reveal if you have fibroid. But X-ray they usually avoid because it has during the process it produces the radiation, and these radiations are dangerous for the ovary of the woman. It can make you infertile, or it can make you have other cancers. so X-ray they usually avoid it at very much. Yeah. So we have certain home remedies and natural treatment that can have a positive effect on fibroid, and this include yoga exercise, massage, hot heat application on the abdomen, and also acupuncture. Those are natural remedies that can have positive effect on person who is suffering from fibroid. Then we have, how can the doctor or again manage this fibroid? You will be given medication, and these medication are hormonal therapy to balance your hormones so that these fibroids can stop growing. And if that one fails, the doctor will recommend what? Surgery, so that you remove for these tumors before they turn into cancerous, or they can turn into cancer. And also, you know that if you have a fibroid, sometimes it's always very hard for you to conceive, because sometimes this fibroid usually develop maybe on the fallopian tube, along the fallopian tube, or they close the fallopian tube, the entry to the fallopian tube, or sometimes they can develop in the lower uterine segment, and also sometimes they can just develop in the uterus, inside the uterus. So this brings us to the questions that was asked: can a woman get pregnant when she has fibroid? Yes, a woman can get pregnant when she has fibroid, and it depends with the location of fibroid. If these fibroids block the fallopian tube, then the sperms cannot pass to where fertilization usually takes place. And also, if it is at the lower uterine segment, sometimes it can close the cervix, and the sperms cannot pass to where it can fertilize the ovum. So sometimes you can get pregnant, yes, and the pregnancy cannot continue up to term, because as the pregnancy grows, the fibroids also grows, because when you are pregnant, these hormones are more, and when these hormones are more, they favor the growth of the fibroids. So you get that they will interfere with the pregnancy. So if you have fibroids, you have to consult your gyne, so that it can advise you, so that the gyne can advise you on when and under which condition you can get pregnant. And also or you can be done for surgery first. They remove these tumors, and then is when you get pregnant. Yeah, so I think I've answered the question. A woman can get pregnant if you are having fibroids, depending on the location and the advice of the gynecologist. So if it was your first time watching this video, please consider subscribing and returning subscriber. Thank you very much. And always, those who are watching, thank you for clicking in, and bye. Let's meet in my next video.